In this video module, we're going to review the different types of pain, and by understanding the different types of pain, it helps us identify the best type of treatment for each pain. So if we were to start off with two different categories of pain, we would split them up into nociceptive pain and neuropathic pain. And then furthermore, nociceptive pain can be divided further into somatic and visceral, and neuropathic pain is one category, but it can be defined as peripheral or central neuropathic pain. So let's take a look at each of these closely. So somatic pain, it involves the skin, the bone, the joint, and soft tissues. So you think of a musculoskeletal type injury, a sports injury, this would be a somatic pain. Pain is usually well localized, and the patient will describe the pain as sharp, aching, or throbbing. Pain is usually constant, so it's usually there most of the day. And there's predictable patterns with it. The pain increases with any movement, but then the patient may say, but at rest, the pain gets less. And a hallmark sign of somatic pain is that because it is well localized, the patient can usually point to the location or site of pain. So in this example, the patient would say, I have knee pain, and tell you exactly where that knee pain is. Visceral pain arises from afferent nerve damage of the soft tissue or viscera. So we're thinking about damage or injury around different types of organs. So the heart, the lung, the gastrointestinal tract, or the GU tract. And if the patient can describe it, they'll describe it as stretching, cramping, or distension type pain. As you can imagine, this is not external pain, so it's poorly localized and difficult to describe. And sometimes patients may just merely say it's deep, aching pain. And it also may be described as colicky or coming in waves. So if you ever think about a pregnant woman who's having contractions, those come in waves. Similarly, the visceral type pain could be described in this way. And then finally, onto neuropathic pain. And this arises from damage to the nervous system, whether it be peripheral nerves are damaged for various reasons, or there's injury to the spinal cord. And this type of pain is really hallmark because it's described, or the words that are used to describe it is burning, stabbing, shooting, numbness, which usually isn't thought of as painful, or electrical type pain. Now, this type of pain may be provoked by a stimulus that usually does not cause normal pain. So if somebody has neuropathic pain in their arm and you lightly touch it, they may feel like you're really punching their arm or hurting it really badly. And this is called allodynia because that area has become sensitized in the setting of neuropathic pain. So if we put it all together, we have nociceptive and neuropathic pain, and then underneath that we could further describe it as somatic, visceral, peripheral, or central. Another type of way to describe pain is whether it's acute pain, and usually that could be defined for a short period of time, about less than a month, or chronic pain, which is longer than that, and in some cases may be lifelong. In the setting of acute pain, you'll see pain, bruising, swelling. Usually in the setting of chronic pain, it's primarily described as just pain. In acute pain, you'll get temporary loss of function. And again, the key word is temporary. But in chronic pain, it will impair the patient, how the patient lives, and there will have to be coping on modifying how they do things in their lives because this pain is always there. You're more likely to get neuropathic pain with chronic pain because there's more likely a chance for you to have damage to the peripheral or central nerves. And then with any lifelong pain, there is progression of symptoms. So in the setting of acute pain, you would treat it as a scheduled therapy. So take this medication, 1-PO-Q12 for 7 days for a short period. Then you can take it 1-PO-Q12 PRN for 7 more days, and then the pain should go away after that or get less. Now, in the setting of chronic pain, where it's a longer period or lifelong, you're going to have to schedule the medication that you're going to use for their pain management. So you take this medication, 1-PO-Q12. And then in addition to that, you can give them a PRN medication. So your first medication, you're going to take 1-PO-Q12, and the second medication, you're going to take 1-PO-Q4 PRN pain when the pain spikes up from its average